So it gives me great pleasure to introduce Vishaal Sumra, who is a PhD student at the University of Toronto, who is going to talk about post-mortem MR imaging of tau pathology, a pilot study. His work aims to uncover and validate neuroimaging-based biomarkers for neuroinflammation, including free water diffusion, MRI, quantitative MRI, and PET.
Well, hello and good morning, everyone. My name is Vishaal. I'm one of the PhD students in Dr. Tartaglia's lab, and I'm going to be presenting some of the work that we've been doing in conjunction with Dr. Kovacs's lab, as well as with the Mice Animal Center at U of T. And I'm just going to jump right into the talk itself. So in terms of the introduction, the first thing I want to talk about is that TBI, or traumatic brain injury, has been shown to be a modifiable risk factor for dementia. Here's a figure that's made from that big Lancet paper that was published a few years ago that suggests that head injury is one of those big 12 dementia risk factors, and there has been a wealth of research that shows even a single or multiple traumatic brain injuries are associated with an increased risk of dementia overall. And furthermore, when going from the larger umbrella term of dementia to neurodegenerative diseases specifically, we do see that there's an increased risk for Parkinson's disease, Alzheimer's disease, frontotemporal dementia, as well as ALS or motor neuron disease as well. And when we're looking at what the actual pathology is for CTE that we see that accumulation of tau within the cell site that we saw in the first talk today. And this is a more progressive neurodegenerative process that evolves slowly over the decades. And the most important thing here to note is that NINDS declaration that traumatic brain injury is that predictor for CTE itself. One important thing to note is that when we're looking at the pathology for CTE at the time of the postmortem analysis, we see that there's a lot of co-pathology. So it's not just the tau accumulation that we see postmortem, there is also accumulation of other misfolded proteins that are associated with these potential other neurodegenerative diseases. Here's a figure on the left from Dr. McKee's group that shows there's a lot of co-pathology, as well as on the right from Dr. Kovacs's group here in our brain donation cohort, where we see that in these patients that we do have CTE confirmed at pathology, there's also a lot of co-pathology occurring where there's other proteins that are misfolding as well. And some of the ways that we can look at this pathology in vivo, so rather than looking at the time of postmortem, we can look at some things with PET using the tau PET, so looking at where that tau is misfolded and located within the brain, as well as more recently, there's been some research looking at synaptic density. And then using MRI itself, which is my focus for the talk today, there are some ways where we can look at neuroinflammation or neurodegeneration using regular standard T1 weighted imaging or some more specified techniques like quantitative T1 mapping or free water imaging, which gives us a little bit more of an idea of where there might be some inflammatory changes, as well as in particular looking at iron aggregation in terms of iron content for tau with quantitative susceptibility or T2 star mapping. And that last one is mostly what I'm going to be focusing on today. And why I'm talking about this quantitative MRI overall, so that quantitative T1 that I just suggested, as well as the T2 and susceptibility, is that there has been a lot of research that shows that in these quantitative images, there are some changes that we can see microstructurally that might not be appearing on those standard structural imaging. So when a radiologist is looking at those regular clinical T1 scans, they might not be able to visually appreciate some changes that we can see on more of a microstructural level that could potentially come out in these quantitative maps. And there is some research that shows that these changes that are observed in multiple sclerosis, for example, cerebrovascular disease, normal aging, as well as Alzheimer's and mild cognitive impairment. And here's just a figure here to just highlight what we're talking about when I'm saying quantitative MRI versus qualitative or that standard structural MRI. So the figure on the left here, these are actually my brain, so if you see any issues, let me know. But the figure on the left here is that standard structural MRI. So a radiologist would take a look at that and see if there's any visual changes they can appreciate with their clinical expertise. However, the figure on the left here, we look at more arbitrary image contrast. So what we see here is also changed by changes with the magnetic coil, so how sensitive they are, how far they are from the brain, as well as some inhomogeneities that could happen in the magnetic field when the patient is in the scanner itself, where these are all taken into account and actually removed from the signal here for those quantitative maps. So the values within this image have meaning, and they can be compared across patients, time points, and research centers, which the actual numbers within the image, we can compare this, which is something that can't be done with these standard clinical scans. And the main challenge that we have is, firstly, we want to be able to get an idea of where this pathology is while these patients are still alive. Oftentimes, we're only able to diagnose CTE post-mortem. So if we can get any correlate that we can look at where this pathology is while these patients are alive, maybe we could get them into care sooner or provide them with as much information as possible. But the intracellular inclusions and some of these neuropathologies that we do see are often too small to be visualized on that standard clinical 1 millimeter MRI. And so here for this study, we wanted to look at sub 1 millimeter or very high resolution MRI. And there has been some studies that looked at a little bit higher resolution MRI in conjunction with the histology or those post-mortem scans. And we do see that there can be some changes that are appreciated on those high resolution MRIs that are in conjunction with iron-based changes or maybe myelin-based changes. Here's a study just published here in Alzheimer's disease, but there hasn't been a wealth done in the CTE space itself. And that's really the aim for this study here, is to use this ultra high resolution MRI to see whether it is sensitive to this neuropathology in CTE patients, given that we'll have data from the post-mortem MRI that we're going to be using, as well as the histology itself. And so in terms of the methods, the data here we got from these 2 post-mortem patients was taken from our biomarker Quest study. This is a large multimodal study that we have these former professional athletes coming in, where we have multimodal MRI, some eye movement data, neuropsychological testing, blood biomarkers, and then at the very end, we're also looking at brain donation. So the goal for this study really is to look at the data that we're getting pre-mortem and post-mortem and see whether or not there are any correlates that we can track pre and post-mortem. And just to highlight here, we're just focusing on that brain donation piece. Overall, we've had 130 subjects where in the end, included in this study here, we have 2 patients in this very early pilot study here. In terms of the methods, we got 2 slabs of post-mortem tissue that I'll be showing you in just a second from 2 different patients with confirmed or pathology confirmed chronic traumatic encephalopathy. These tissues were soaked in Prohance for 3 weeks for preparation for scanning. They were scanned at very high resolution, so 0.04 millimeters isotropic resolution. So that's 40 microns. And they were scanned with this T2 weighted structural image, so you can look at just the regular structure, as well as these quantitative MRI sequences with R2 star and R1. Those are essentially the same as that quantitative T1 and quantitative T2 star that I was mentioning earlier. And then finally, they were sectioned at 0.004 millimeters thick and stained for tau using AT8, GFAP or gastrogliosis using GFAP, iron with the PERLS, and then for cell bodies using H&E and Luxol. In terms of the MRI protocol, we can talk about the specifics later on if needed, but the main thing to focus on here is that we have that 0.04 millimeters isotropic resolution. And when we're talking about these quantitative maps later, we have the quantitative susceptibility and R2 star maps that are more iron sensitive. So these could be more sensitive to iron-based changes within the brain. And then secondly, that R1 map is more related to tissue density or neuroinflammation. We have these 2 patients' demographic information here. So they are 82 and 84 years at the age of death, respectively. They were both professional American football players, and one of them was a professional wrestler as well, both with a history of multiple concussions. Clinically, they presented with deficits in concentration, executive functions, irritability, apathy, etc. And patient 1 was followed clinically with the suspicion of potential chronic traumatic encephalopathy, whereas patient 2 was followed with a diagnosis of dementia due to possible AD, frontotemporal dementia, or CTE. And when we had that pathology, they were confirmed to have, both of them were confirmed to have pathology related to CTE, Alzheimer's disease, TDP-43, aging-related tau astrogliopathy, or RTAG, as well as cerebral amyloid angiopathy, or CAA. And also patient 2 was shown to have mild Lewy body disease as well. And when we're getting into the results, really what we did here was we took this high resolution MRI that was 0.04 millimeters in resolution and compared it to the histology to see where we could see if there is a correlation where we see inclusions on the histology and if that correlates with any changes in the MRIs. Just to show off what the actual images look like. So here's the example of that structural image that we had. This is a T2 weighted image in patient 1. And we do see that there are some fine white and gray matter structures that are visible here that aren't visible on a regular structural MRI that we get in the clinic. So those white matter structures that we can see kind of within those crosshairs there actually are not usually apparent on a regular structural MRI. And here's just the area that we have. So in this section for patient 1, we have part that includes the thalamus, hippocampus, as well as the lateral ventricle. And in patient 2, we have a large chunk of the temporal lobe, as well as the hippocampus and a little bit of the thalamus as well. And when we're looking at these quantitative MRI maps that we have, the first thing that we can see is that there is a little bit more delineation between structures here. So it's not just that gray matter, white matter boundary. Now that we have this color map with these images that have meaningful values within them, we can see that they do fall within the realm of reference values for healthy tissue in the elderly. However, there are some technical challenges that we're trying to work through with some image blowout problems in those little circles, if you can see those there. And in that second patient, we also have that quantitative R1 map. That gives us a little bit more information related to tissue microstructure for density and or neuroinflammation. And here's just an example of what these maps look like. And we also have that susceptibility map, which is a more strongly related to iron as well. And for that susceptibility map, again, we're also trying to work on a couple technical challenges for these ones. Stay tuned for the publication for the R1 map because we just got that data very soon and very recently. And then when we're looking at this in conjunction with the actual histology, there are 2 main findings that we see. Firstly, when we're looking at in areas with decreased cell density, so that's that area in that red box in that H&E scan, and compared to an area that does not have that decrease in cell density in those blue boxes below, we do see that there is an increased signal intensity in that T2 weighted image, which is second from the right there. And we see a decreased in measured R2 star, which is that furthest one on the right there as well. And this increase in signal intensity in the structural MRI and decrease in quantitative R2 star, we also see in areas where we have more AT8 immunoactivity or more tau binding. We can see that in that top red box compared to that middle blue box there as well. That figure is not correct on the right there. Anyway, and then the final one, we do have this also happening in areas where we have tau binding as well as G5 binding as well, where we see that increase in T2 weighted signal and that decrease in measured R2 star. And really what I'm trying to get at by this is that we're able to see or visually appreciate, at least for now, some differences in these quantitative and structural MRIs, very high resolution post-mortem, that are findings that are in conjunction with the histology. So we're able to appreciate some of this pathology using the MRI itself. We can look at fine gray and white matter structures that are visible on this MRI, as well as the decreases in cell density, tau binding, or GFAP binding are associated with that change in the signal intensity in the structural image and the change in the actual quantitative value in that quantitative MRI. In terms of next steps, we aim to look at the more quantification of these microstructural images. So for this preliminary analysis, given that we only have 2 patients, we've really only looked at just general changes in what we see in these signals. Whereas in the future going forward, we're hoping to look at quantifying these values, seeing what changes in terms of these histograms, looking at more of a whole brain high resolution quantitative MRI. There is some research being done by Dr. Irwin's group at UPenn that does whole brain quantitative MRI. So we're hoping to do something like that at a very high resolution, as well as investigation into co-pathology. So not just looking at these iron or tau changes, but also looking at maybe TDP43 or if there's any other proteins that we can try and look at as well. And all of this work would not be possible without our amazing collaborators. So everyone else in the Tartaglia lab, everyone at the Canadian Concussion Center, the Rogeva lab, Dr. Kovacs's lab, Dr. Uladag's lab, and of course, Dr. Sled's lab from the Mice Center at U of T, the patients and the families, and all of you lovely people for your time and attention. Thank you very much.
You. Any questions?
Well, I think it's fantastic
Thank you.
that we've been able to do this. So congratulations, all those involved. Do you think that you'd be able somehow to assess the lymphatic system with this correlation that you're able to do?
Yeah, definitely. I think it's definitely a budding field where especially these figures or these metrics that we can get, particularly being that, hopefully I can go back to the right slide here to show it for you. That T1, which is that metric that's a little bit more related to that tissue density or inflammation. So that's a little bit more sensitive towards the water content within the tissues. So that is one of those candidates that we could use potentially to look at the lymphatic system. However, there's other things we could look at as well, I'm sure. Yeah.
Thank you. Any other questions? comments? Let me check online, make sure I'm not missing anything. No? Okay, well, thank you very much.
Thank you.